Hello, ladies and gentlemen, and welcome to the pilot episode of what I call Microbiology Boot Camp. This is my first of what I hope to be several videos talking about the nitty-gritty of microbiology. My name is Dr. Paul Bolin. I am a physician and an MPH, and I have been making videos for several years targeting clinical sciences, mostly towards step 2 and step 3. And this is my first foray into stuff that's more pertinent to step 1, so more of the hard sciences. And microbiology was always one of my favorite topics in medical school, and it's something that as a physician you get very, very familiar with. So it wasn't much of a stretch for me to go ahead and make some of these videos dealing with some of the details of microbiology and the different pathogens. And it's, of course, we're living in a pandemic world right now, so microbiology is more important now than ever. So hopefully we can have some fun with these videos. I try to keep them lighthearted, give you plenty of mnemonics to remember. I've always said microbiology for step 1 is like going into a room with 200 people and having to learn everyone's name, everyone's family, where they're from, what their favorite foods are, what their kids' names are, and it can be really overwhelming. So my hope is that I can give you a systematic way of easily remembering these things if you're in medical school or you're preparing for step 1, or if you're just somebody that's just generally interested in the invisible world. You should find these videos useful. If you haven't had the opportunity yet, please consider subscribing to my Patreon at www.patreon.com/pwbmd. You can get there by clicking the link below, or the whatever the little link is that YouTube gives you that should be popping up on your screen. If you could just chip in $1 a month, a little bit goes a long way to help keep these videos coming. I really, really appreciate any support you can give. Thank you very much in advance. All right, so this video is going to be focused on gram-positive bacteria. And we have one way of classifying bacteria, the most common way of classifying bacteria, and that's based on how it stains in something called the gram stain. Now, there are other ways that we can stain bacteria, but this is by far the most common way to do it, because the vast majority of bacteria fall into one of these categories. Now, some don't, and the big one would be like Mycobacterium tuberculosis, which does not stain with a gram stain because it's got a totally different structure. You need a carbofusion stain, which is different. They call it an acid-fast stain, and thus it's called an acid-fast bacteria. There are other bacteria that don't stain very well, and so not everything is gram-positive or gram-negative, but most of them are. And now, when you take step 1, if you don't know if a bacteria is gram-positive or gram-negative, you're not even going to be able to come close to approaching the question, much less getting it right. So knowing the basics of what makes an organism gram-positive, what makes an organism gram-negative, is really the first way to go about answering a question right. You could get a test question that gives you a clinical vignette, and you know the bacteria, and you feel really confident, and then they might ask you something about the cell wall. So to start, it really helps to know the difference between the gram-positive cell wall and the gram-negative cell wall. And as you can see here, they are substantially different. Now, the first thing you probably have noticed is that a gram-positive cell wall only has one plasma membrane, and that is different from the gram-negative cell wall, which has two membranes, two phospholipid bilayers, and that's the plasma membrane and the outer membrane, and both are composed of phospholipid bilayers. So I'm going to stick primarily here to gram-positive and just kind of compare to gram-negative as we go. The second thing that you probably notice is this peptidoglycan layer, and peptidoglycan is just a repeating link polymer, if you will, of proteins and sugars. And this is an important cell layer because it is actually one of the targets of one of the more commonly used family of antibiotics. So you can see with gram-positive, you have a much thicker peptidoglycan layer, and it's on the very outside. Whereas with gram-negative, it's kind of in the middle, and there are other things. There's the outer membrane, and there's some proteins, and some chains on the outside of the peptidoglycan layer. But on the gram-positive cell wall, it's on the very outside. Another thing that separates gram-positive from gram-negative is the presence of what we call teichoic acid. Teichoic acid is unique to gram-positive organisms, so you do not see it in gram-negative organisms. Now, on the other hand, something you don't see in gram-positive organisms that you do see in gram-negative organisms is something called lipopolysaccharide, which is right here. And lipopolysaccharide is a very important component of the gram-negative cell wall because it is responsible for a fulminant immune response that can lead to sepsis. So when we have gram-positive organisms, they themselves are not so responsible for sepsis. Can you get sepsis with a gram-positive organism? Yes, you can, but it's typically not from the cell wall. It's generally because of toxins. So like toxic shock syndrome, not because of the bacteria itself, it's because of a toxin. So lipopolysaccharide is something in gram-negatives that we do not see in gram-positives. Now, what else? So that's a general idea of the gram-positive cell wall. It's much less, much more simpler than the gram-negative cell wall. But what are some other things about gram-positive bacteria that you need to be aware of? Well, first of all, gram-positive bacteria, some of them, not all of them, but a good number of them, have the capability of forming spores. And we're going to go into each genus of bacteria individually in subsequent videos. But you'll see with the gram-positive bacteria, many of them are capable of forming spores. So the Bacillus genus, the Clostridium genus, they form spores, and that's a very important part of their life cycle, that they can do that, and also a very important part of their ability to cause disease. Okay, and then another thing is antibiotics. Okay, so what about beta-lactams? What do we know about beta-lactams? Well, beta-lactams interfere with the building of the peptidoglycan layer. And so because the peptidoglycan layer is so much bigger in gram-positive bacteria, we would expect beta-lactam antibiotics, so things like penicillin, ampicillin, to be much more effective against gram-positive bacteria. Not so effective against gram-negative bacteria. There's some of the newer beta-lactams that are effective against gram-negatives, but for the most part, when you're talking about a beta-lactam antibiotic, that's more for gram-positive diseases from gram-positive organisms. All right. And then one last thing that I want to bring up, and that is toxins. So toxins are formed by both gram-positives and gram-negatives, but the sort of toxins that they produce are different. Gram-positive organisms tend to form exotoxins. So that is an exotoxin is a protein that's made by the bacteria, and it's exported. And that toxin can work in a variety of different ways on other cells, and it can cause cell death or it can cause cell dysfunction, but it works on other cells. Gram-negative organisms, I apologize, I think I activated my my computer here. But gram-negative organisms have endotoxins, and these are toxins that are endogenous, native to the bacteria itself. So a little bit different, and a little bit different from the gram-positive. So gram-positive, exotoxins, gram-negative, endotoxins. We are going to talk about a lot of toxins as we go into all of the different bacteria in future videos. All right, so this is kind of a laboratory deal here, but I want to go into something called a gram stain. We alluded to it earlier, and what it is it's a way to stain bacteria that will help tell you if it's gram-positive or gram-negative, and that's very important because when we classify bacteria, one of the first things that we want to know is it gram-positive or gram-negative? Now, is that going to tell you what bacteria it is? Absolutely not. But it will be the first step in narrowing it down. It's useful to know how the gram stain works, and you may have done it if you took a microbiology course in college. You probably won't do this in medical school, but I think it's useful because we can correlate it to the different structures of the gram-positive versus gram-negative cell wall. So what you do with a gram stain is you take your bacteria from your culture, you put it onto a slide, and the first thing you do is you add crystal violet. Now, crystal violet is going to stain the bacteria. And crystal violet goes into the peptidoglycan layer. Now remember, the gram-positive organism has a thick peptidoglycan layer. The gram-negative organism, not only does it have a thin peptidoglycan layer, but it's got all that stuff on the outside of it. It's going to make it hard for crystal violet to get in. Either way, after you stain with crystal violet, both are going to look purple, violet purple. And you add some iodine that helps keep the crystal violet in the peptidoglycan layer. But then what you're going to do after you add iodine is that you're going to wash the bacteria, getting the crystal violet out as much as you can. And what will happen is that with the gram-positive bacteria, that crystal violet is so stuck in the peptidoglycan layer that it's not going to wash off. Whereas with the gram-negative bacteria, it's going to wash right out. And you'll be able to tell right away when you're dealing with a gram-positive organism, because you'll be able to see, and usually it's visible to the naked eye, you'll be able to see little dots of purple. And that tells you you're probably dealing with a gram-positive organism. But in any case, you've got one more step, and that is to add safranin. And safranin sticks to the outer phospholipid layer. And so when you add safranin, that's going to stick to gram-negative organisms. And to whatever degree it does get in and stick to gram-positive organisms, it's going to be completely made, you're not going to be able to see it because you've got crystal violet and that's way darker. All right, so what you're left with then is a gram-negative organism, which is either red or pink. It's kind of a reddish pink. And then a gram-positive organism, which is purple. And if you know gram-positive is purple, gram-negative is reddish pink, you know positive versus negative, and that's the very first step to identifying an organism. Now, it's possible that it may not fix either, and in that case, you're probably dealing with an organism that's neither gram-positive or gram-negative, and there are organisms that are like that. So here you can see what you would see under a microscope, and you can see the difference. One is purple, and the other is reddish pink. This is gram-positive, this is gram-negative. If you know this, you are on your way. But there are so many other things that we're going to need to figure out about the bacteria. We're going to need to figure out different things about what kind of proteins they have, and there are various tests that you can do, and we will eventually go into that. Another thing that helps when you look under the microscope is the shape. We're going to talk about cocci and the different ways that the cocci can arrange. We're going to talk about bacilli or rods. We're going to talk about branching filaments. And knowing that is going to help you even further narrow it down. Okay? So this is just kind of going back to the exotoxins and endotoxins. I'm not going to read through all this, but you have this available for you. But it just goes into what exotoxins are versus endotoxins. And one of the things that I want to point out here while we're here is the antigenicity and the presence of a vaccine. So with exotoxins, you can have an immune response to that. So let's say that you step on a rusty nail, you haven't been vaccinated for tetanus for 15 years, and you know you're supposed to get your tetanus vaccine every 10 years, but it's been 15 years. You step on a nail, you go into the ER. What are they going to do for you? They're going to give you an antitoxin. And what an antitoxin is it's essentially an antibody that will bind the tetanus toxin and prevent it from having its effects on your cells. Okay, and that's called an antitoxin. We also call that passive immunization. So a regular immunization, you give a toxoid into your own body and you form your own antibodies. This, we're giving you antibodies from somebody else, but ultimately it has the same effect. Now with exotoxins, there are vaccines available. and that's just what I told you. You give a toxoid, something that looks like the toxin that can elicit an immune response, and that immune response then will form antibodies that if you're ever exposed to the toxin and it gets into your body, it won't have an effect because you have antibodies to neutralize it. Okay? Now, what's one vaccine that we give regularly? I already talked about the tetanus vaccine. What's another one? The DTaP vaccine, diphtheria, tetanus, and pertussis. So the diphtheria has a toxin that we vaccinate against, and then it's combined with the tetanus toxin that we vaccinate against, and then there's another component, acellular pertussis, the AP. That is from Bordetella pertussis. That's a gram-negative organism. We're not going to be going into that for a long time. But I just want to point out to you that exotoxins, we can vaccinate against that. Endotoxins, we really can't. We can't do anything about that. Okay. So we're going to look at the structures of these different organisms, and just by looking at the structures of the organisms, you're not going to be able to pinpoint what the exact genus and species is yet. There are other tests that you'll have to do and you'll have to be familiar with in order to identify the exact organism. But again, the second thing really you need to do after knowing gram-positive versus gram-negative is then to look under the microscope and know the morphology of the bacteria. And you'll see this sort of morphology, cocci, bacilli, and filaments, and not so much filaments, in both gram-positive and gram-negative. So you'll want to know these morphologies and what they look like. So the first one is cocci, and cocci are round, they're spherical, and there are two ways that they can interact with each other. One is that they can form cocci in clusters. These clusters look like grapes. Okay, not only are they purple, but they form these little clusters, and they look like a thing of grapes that you get off of a tree. Cocci in clusters are always Staphylococcus. Okay, so now you know the genus. Okay, you did your gram stain that's purple, so you know it's gram-positive, and you know they're cocci in clusters. You may be told on the test, gram-positive cocci in clusters, and you'll need to know that that's Staphylococcus. I probably should have italicized this here because it's a genus. But in any case, this is Staphylococcus, just by virtue of the fact that they're gram-positive cocci in clusters. That's the definition of Staphylococcus. Now, there are 3 different Staphylococci genuses that you're going to need to be aware of for step 1. And you can't tell just by looking at this whether this is Staph aureus, Staph epidermidis, Staph saprophyticus. There are other tests that you'll need to be able to do to get there. But this is, again, your second step. And now you've got it narrowed down to 3. Okay, so you're on your way. And this is Streptococcus. And Streptococcus is cocci in chains. So sometimes you look at it and you don't want to get distracted because sometimes they can clump up a little bit, just as sort of an artifact, if you will, from doing from fixing them onto your slide. But you want to look, do they tend to form more clusters or do they tend to form more chains? And you see much more chains here. Okay, these linear sort of arrangements of the cocci. And so you see right here is probably the most prominent example, but very different from the clusters. Cocci in chains is synonymous with Streptococcus, and there are a lot of different Streptococcus genus or species. We will eventually go into those, and you're going to need to know how to differentiate them, and there are other lab tests that you can do. But like I said, if you get to this point, you already know you're dealing with Streptococcus, so you're on your way. Now this is different. These are not cocci, these are bacilli, and bacilli are long, so they're also called rods, but bacilli is the more proper term, and these are long, they almost look like tubes, and that's a bacillus. And so you can see here, they don't necessarily form chains, although sometimes they can kind of interact with each other, stick together a little bit, but usually they're on their own. And so you can see they're very different. These are spheres and these are chains. So this is bacilli. These are bacilli, and they're gram-positive because they're purple. And this particular uh, stain here is of a bacteria that you've probably encountered in the hospital, or at least you've had to watch out for it, and that's Clostridium difficile, which is the cause of pseudomembranous colitis. And then there's one last big category of gram-positives, and that's the branching filaments. So you can see they look a little bit different. They're a lot more stuck together, and they form almost like a tree sort of appearance, where they kind of just branch off from one another. You see that here where they're just kind of branching. These are branching filaments, and there are two genuses of gram-positive branching filaments that you'll need to be responsible for. Again, you're not going to know just by looking at the microscope alone. You'll need to know other things about the bacteria or about the clinical history that will tell you what you're dealing with. Okay, so this is an algorithm for telling what you're dealing with. And you can see here that your first step is to tell if it's gram-positive versus gram-negative, and then to know the shape. Is it a bacillus? Is it a cocci? If so, is it in clusters or chains? Is it a branching filament? And you can see here, if you go down this list, and we're going to go into each of these in subsequent videos, but there are other tests that you can do. Okay, so not only if you look under a microscope, is it a chain or is it a cluster, but there's tests that you can do called a catalase test, or there's a coagulase test, or you can check to see how sensitive or resistant it is to different bacteria or different antibiotics like optichin, bacitracin, novabiocin. And you'll need to know each of these tests. Okay, so we're going to go into all of these in detail. Now, once you can get to the point where you know what genus and what species you're dealing with, then you're at a good point. However, step one is a medical licensing test, as you know. So they're going to give you clinical vignettes. And a clinical vignette will give you a patient and a history, and they've got an infection, and you might know which bacteria they're infected with. Let's say they're infected with strep agalactiae. It's a neonate with meningitis, and you know it's strep agalactiae. And what they might ask you is, what are the characteristics of this bacteria? And you'll need to know not only that it's a Streptococcus, so it's gram-positive and it forms chains, but you'll also need to know it's beta hemolytic, it's bacitracin resistant, and so you may get a test question where you get A through E, and you'll have gram-positive, gram-negative, bacitracin sensitive, bacitracin resistant, alpha hemolysis, beta hemolysis, and you'll need to know each of those. All right, now that doesn't happen on step 2 or step 3. On step 2 or 3, as you might know, your next question would be, what's the next step in management? They're not going to ask you about the microbiology of it, but you'll need to know for step 1 how to describe the bacteria from a clinical vignette. This is not going to be enough. If you look at this, this is not going to be enough for you to get test questions right, because it's not enough to just know the bacteria and the characteristics. You'll also need to know what are the toxins that they make, if any. How do the toxins work? Do they affect a channel? Do they work on the outside of the cell or the inside of the cell? Do they affect DNA synthesis? Every toxin works a little bit differently. You also need to know the virulence factors. Virulence factors are what makes a bacteria or any microorganism cause disease. Not all bacteria cause disease, right? You've got bacteria in your probiotics or in your yogurt or in your cheese. They don't cause disease because they don't have virulence factors. So you'll need to know the virulence factors for all of these. And you'll also need to know what diseases they cause, and then eventually you're probably going to need to know some of the antibiotics of how we treat these. So there's lots and lots and lots of stuff to know for microbiology. Our next video is going to be going into Staph aureus, which is one way that we work down here. And then the video after that is going to be on the coagulase negative staph, which is Staph saprophyticus and Staph epidermidis. So I'm going to try to keep these in little bite-sized pieces. I know this video went long, but this is sort of an overview. I'm going to try to keep each video under 10 to 12 minutes so that you can get the gist of everything just what you need to know for the exam. I know I have kind of have a reputation in my clinical videos of being a little long-winded. You can always, if you want, you can always speed up my dialogue on the bottom there to like 1.5 if you think I'm talking too slowly or whatever. But I'm going to try to keep these pretty concise. So with that, I will see you in the next video. Please hit subscribe, share it on Facebook, recommend it to your friends. I really appreciate it. I'll see you next time.